Hello students, welcome to Pharma Syndrome YouTube channel. I hope you already enjoying our videos as well as our mnemonics, tricks as well as concepts. So please subscribe to our channel. If you already subscribed, thank you so much. And please share to your friends also. So this is a channel for the people who are preparing for GPAT, NIPER and other pharmacy competitive exams. And please like, share, comment our channel and press the bell icon for the daily notifications. And today our session is regarding the medicology of the GABA analog. So here medicology means medicinal chemistry plus pharmacology of GABA analog. So what is GABA analogs? I hope you already know gamma amino butyric acid is a inhibitory neurotransmitter in the central nervous system along with the glycine. Both the GABA glycine are inhibitory neurotransmitters. They are in the central nervous system. Here, this GABA analogs, the drugs shows action like GABA. The drugs increase the action of GABA by increasing its concentration in the synaptic vesicles. Okay, so here we starts with the drug Vigabatrin. So if you know the spelling of Vigabatrin, Vigabtrin, Vigabatrin. So Vi means here it is vinyl. So Vi means vinyl, and GABA means gamma amino butyric acid, and TR means transaminase. IN means inhibitor. So it is not like that, but here I am telling by this also you can easily understand a one drug. For example, Vigabatrin. So it is not a rule. Vigabatrin, Vi means vinyl, not like that. So simply for your easy remembering, I used this trick. So vinyl GABA transaminase inhibitor. So here, what is this GABA transaminase enzyme? So vinyl means regarding its chemistry, and transaminase means transaminase is the enzyme responsible for nothing but GABA. GABA transaminase is an enzyme responsible for metabolic degradation of GABA. In the epileptic patient, we have to increase the GABA concentration in the synaptic vesicles, synapse, that is between the two neurons. And especially you have to increase the GABA concentration at the post synapse in the brain cells. When GABA concentration increased in the brain cells, the excitated neurotransmission decreases and decrease the symptoms in epilepsy. I hope you know epilepsy means excess firing of neurons. The excess firing of neurons is because of excess neurotransmission. That is excess overactivity of excitated neurotransmission like aspartate glutamate. So aspartate glutamate are major excitated neurotransmitters in the brain. If this major excitated neurotransmitter activity is becoming more, it leads to epilepsy, one of the CNS disorder called as epilepsy. So for that, if you have to treat epilepsy, we have to nothing but in the subject we have to reduce the excitated neurotransmission and we have to increase the inhibitory neurotransmission. Like here, GABA analogs, they show action like GABA or they may increase the GABA concentration in the brain cells. So this is simply about the Vigabatrin. So chemically it is a vinyl and GABA, gamma aminobutyric acid, TR means transaminase and inhibit the GABA transaminase. When GABA transaminase enzyme inhibited, then no metabolism of GABA. Then no metabolism of GABA means more amount of GABA is present at the synapse, nothing but postsynaptic neuron. So that excess GABA reduce the excitated neurotransmission and increase the inhibitory neurotransmission like GABA glycine action and controls the epileptic symptoms in the subject or patient. Okay. Next, here some of the GABA analogs. So before that, we have to keenly observe the structure of GABA. So this is not a difficult, it is easy. That is, so here GABA, gamma amino butyric acid, name itself indicating gamma amino. So here, this is the functional group carboxylic acid. So GABA is a amino acid. So here the functional group is carboxylic acid, after that alpha, after that beta, and after that gamma position. So that's why at the gamma behind there is a amino group, that is gamma aminobutyric acid. So based on this only, the GABA analogues are designed. So if you observe here, it is a GABA pentin. So GABA pentin also, if you observe, the whole structure is GABA, and just here there is a addition of another group like a cyclopentane group. So this is simply cyclopentane. Okay, it is cyclohexane group, but without this carbon, it is a cyclopentane. That is GABA pentin. 5 carbon chain, that is cyclopentane is added, and the remaining portion is GABA. Then this shows action like GABA and increase the GABA action and reduce the excitatory neurotransmission in epileptic patient and control epileptic symptoms in the subject, nothing but patient. Next, here is Pregabalin. This is a Pregabalin. So here also, if you observe the structure, it is also having similarity to the GABA. Both Pregabalin, GABA pentin are called as analogues of GABA. They shows action like GABA. So they derived nothing but they derived based on the structure of GABA, and they mimics the action of GABA. So this is a Pregabalin. So this is also called as isobutyl pregabalin. Simply, it is also called as isobutyl pregabalin. And next one is the phenin-bute. That is, phenyl group is attached to the GABA. So here also same thing. Again, GABA, the structure of GABA, gamma amino butyric acid. Amino group, it is adjacent to the gamma position of the GABA. So this phenin-bute is not having that much clinical applications because it having side effects and it is withdrawn from the US market. And again, this is our main hero here. We are talking about Medcology of the GABA analog, that is Vigabatrin. Vigabatrin is a chemically having vinyl group. So this is the vinyl group. This is a vinyl group. So in generally, here it is a GABA, sorry, carboxylic acid group. If you observe here, it is a carboxylic acid group, but instead of that, it is converted into vinyl group, and here is a okay. So here this is a structure of Vigabatrin. So here there is a vinyl group. Here there is a vinyl group, and here it is the carboxylic acid group. Here it is the carboxylic acid group, and simply here there is the extra addition of the vinyl group, double bond. So if you observe here, this is the amino group here in the GABA, but here there is an extra vinyl group. There is an extra vinyl group, double bond, and remaining everything is the same like a GABA, gamma amino butyric acid. So vigabatrin is a inhibitor of GABA transaminase enzyme. If GABA transaminase enzyme was inhibited, then there is no metabolism of GABA, increased concentration of GABA, increased GABA levels in the brain, reduce the excitatory neurotransmission, and reduce the epileptic symptoms. So this is a simple chemistry of GABA analogues, which acts like GABA, nothing but they shows action similar to GABA by acts like GABA itself or increase the concentration of GABA in the post synapse of the brain cells. Next, here simply clinical applications. Clinical applications like first one is vigabatrin. First one is vigabatrin. So vigabatrin is a irreversible inhibitor of the GABA transaminase enzyme and increase the GABA levels. And it is used to control. It is used to control infantile spasms. That is nothing but observed in the infants. Next, GABA pentin pregabalin. Both GABA pentin pregabalin are their anti-epileptic agents. Apart from that, they're also having analgesic activity. They reduce the pain. They reduce the pain. So generally, these are shows action similar to GABA, but their mechanism is still confused. But one of the possible mechanism, what scientists are telling means they blocks the calcium channels in the presynaptic neurons in the brain cells. When that calcium channels are inhibited by this GABA pentin and pregabalin on the presynaptic neuron, what will happen? There is a, when calcium channels are blocked, no activation of voltage gated calcium channels, and if there is a no calcium involvement in the presynaptic neuron, no release of neurotransmitter. So if there is a no release of neurotransmitters, especially excited neurotransmitters like aspartate glutamate. If the neurotransmitters are not released, then excited neurotransmission reduces and increased activity of inhibitor neurotransmission and control the symptoms of epilepsy. And as I already told you, gabapentin as well as pregabalin, apart from anti-epileptic action, they are also having the analgesic action. Because of that, they are having other actions, nothing but other clinical uses other than the anti-epileptic action. So here, gabapentin also used in diabetic neuropathy, the inflammation in the neurons because of diabetes, and also used to control partial seizures, and also for post-herpetic neuralgia, and also for prophylaxis of the migraine. Okay, and next regarding the pregabalin, apart from anti-epileptic action, pregabalin also having anxiolytic, anti-anxiety action. So used in epilepsy as well as anxiety. And also used for nerve pain caused by the diabetes and shingles or nerve pain because of any injury. Okay, so this is a simple medicology of GABA analogs like vigabatrin, pregabalin, gabapentin drugs. I hope you enjoyed the session. So, and this is a Pharma Syndrome YouTube channel. Please subscribe and press bell icon for daily notification. Follow us on Facebook, Instagram, Telegram, even LinkedIn also. And a new batch open for GPAT 2023. So if you're interested, contact us. For details, contact us. And we are starting with the demo classes. 5 demo classes are there, 5 different subjects. If you like our sessions, you can continue our coaching. Okay, thank you. Please share to your friends. And GPAT 2023 starting from March 4. Thank you.